See, oh, I'm sorry, it's being translated. So as Ms. Kim shared, this Zoom is being recorded. So if we don't have your consent to record, we ask if you can please turn off your camera or please excuse yourself from this Zoom. It is being recorded and it will be shared on our websites. So now real quickly, an agenda, it's the welcome and introductions and technical logistics, which we just did. Next, we will have the presentation from the Los Angeles County Department of Public Health. And finally, we'll have a quick questions and answers and closing. So let's get started. Our union, Local 99, has partnered with the Los Angeles County Department of Public Health to bring you the latest information on COVID vaccine, the county's distribution process, and answer your questions. Our members had the opportunity to participate in listening sessions with the Department of Public Health to provide input on how to best engage with our communities around the vaccine. We want to continue this dialogue and ensure that providers' voices are heard as we navigate these challenging times. I would like to welcome and introduce Dr. Mrna Vaccines, who is a medical epidemiologist with acute communicable disease from the Department of Public Health. She's also the pediatric infectious disease doctor and lead for vaccine distribution for the education sector.
Thank you so much. Should I go ahead and share my screen? Great, I will share and we'll get on our way. Great. So first of all, thank you so much for inviting me to be part of this group. I am here to answer any questions about the vaccine and the vaccine rollout. I want to again share my gratitude for everyone in this Zoom. We're so grateful for everything you've done this past year for the well-being of our communities and of our children. And I'm hoping that this vaccine rollout will be able to access the vaccine and hopefully will help you resume some sense of well-being and return to a more normal state. So I, first of all, have to go through some disclosures. There's no commercial support. I have no financial interests. This is obviously a very rapidly evolving situation, so my slides are appropriate for today, but please note that things might change in the future days. I usually like to show an epidemiological curve, just showing how COVID-19 has, the pandemic has affected us. So the green line in this graph shows the case rates. So you can see that we started off slow. We had a little bit of an increase in July. And then for most of the fall, we did well until shortly after Halloween. And then that's when our surge began. And the surge was quite horrific. As you can see, we almost had 20,000 cases every single day. And luckily we're coming down and we're going to lower levels. We're roughly about 1,000 cases per day now. Unfortunately, our deaths and our hospitalizations are still high. So I think, again, we have to remember to take care of our communities, take care of ourselves, and do all the infection prevention protocols that we know about now, including masking and social distancing, because we're unfortunately still not out of the woods, but we are luckily not where we were just a few weeks ago. As far as the number of deaths reported, this is of the first. So we're still having more than 100 deaths a day from COVID-19. Overall, we've had about 22,000 deaths. We've, like I mentioned, usually have 1,000 to 2,000 cases a day. So more than 1.2 million people have been now infected. About anywhere from 1,200 to 1,400 are hospitalized, which is a horrific number, but just in December and January, we were up to 8,000 individuals hospitalized. So it is improving, and we're hoping that this number continues to go down with vaccine and with people wearing their mask and continuing to take care to socially distance. So I'm going to talk a little bit more about the vaccine. As you know, starting March 1st, we have opened up vaccine eligibility to include early childcare and education. And our goal is to make sure that every single person who wants the vaccine has access to the vaccine and is able to get it. So many of you know that COVID-19 is caused by a virus called SARS-CoV-2 or SARS coronavirus 2, and it can affect people in different ways. Some people with SARS-CoV-2 never have symptoms. So about 40% of individuals don't have symptoms, but unfortunately they are still infectious, meaning that they could still give the virus to other people. Then there's another category of people that get mild or moderate disease. So they get just flu-like symptoms. Some body aches, some fevers, cough. And then others get severe illness and end up going to the hospital. This is much more common when you're over the age of 65 and people who have underlying medical conditions like diabetes and obesity and heart disease. The most concerning part is that you can pass the virus to people before you have symptoms, and even if you are asymptomatic, meaning you have no symptoms. So you could feel fine, but still pass on the virus. And that's why masking is so important as a tool to fight this virus. We also know that vaccines are an incredibly important tool to fight this devastating illness. And vaccines have been safe and effective to prevent disease for other diseases and save millions of lives each year. And the way that vaccines work is that they basically show your body's immune system how to recognize and fight germs. So a lot of virus vaccines will have a dead version or weakened version of the germ in them. Others have parts of the germ. So you see the parts of the germ, and then that's how your body will react and become strong and understand how to fight the virus. The vaccines that we have, most of the vaccines we have now for this virus are mRNA viruses. An mRNA virus is an instruction manual. So an mRNA is a tool that our body already has to teach it how to make different proteins to make our body function. And so this virus, this vaccine, it basically is an instruction manual for your body to make proteins that look like the coronavirus spike protein. And that teaches your body to fight it. And I'll talk a little bit more about that in the next slides. So when you get a vaccine, your immune system responds to it by making antibodies. And also it teaches your cells to remember and to form antibodies if you get infected with it in the future. So you get short-term protection, and then you should also have long-term protection. So that way, once you get the vaccine, if you're exposed to the germ, your immune system remembers how to fight it, and you don't become sick or pass it to other people. So we have 3 current vaccines available in the United States. 2 of them are the mRNA vaccines, Pfizer and Mrna. These have been studied in trials and have been shown to be 94 to 95% effective at preventing COVID-19 disease. They're both 2 doses. You have to take them either 21 or 28 days apart. And a point I want to make is if you go longer than 21 or 28 days, that's still okay. You should still get the second dose. It still will be effective. So it's really important that after you get your first dose, you get your second dose. And if it's a little bit later, that's still okay. You still should get it. And then most recently, we have the Ganson Johnson & Johnson vaccine. This is also very effective at preventing severe COVID-19 disease. This one's only 1 dose. And the other part that I really want to emphasize is that you have 3 different vaccines, but all the vaccines have been 100% effective at preventing death. So out of the trials that were done, over 100,000 individuals got the vaccines, and not a single person died from it, from COVID-19. So I think it's really important for us to remember that these vaccines are a little bit different here and there, but they're all 100% effective at preventing death. And that's really what we're trying to do. We're trying to make sure everyone stays healthy. So here's a little slide about the mRNA vaccines again. The mRNA vaccine is, oh, excuse me. The mRNA vaccine, so the mRNA is this little blue strand, and it's inside a lipid nanoparticle. Pfizer has a type of lipid nanoparticle, and Moderna has a form of lipid nanoparticle, but they're basically these little oily bubbles. And then it goes into your cell. It teaches your body to make spike proteins. The spike proteins are then displayed, and your immune system then recognizes them and is able to fight the virus if it should attack your body. The parts that I want to emphasize here is that the mRNA is not DNA. It doesn't go in the parts of your cell where the DNA is. So the DNA is in the nucleus. It never enters the nucleus. And then once it does that, once it gives the instructions, it then disintegrates. So it doesn't last in your body. It goes away right away. It's just there long enough for it to be for the instructions to be handed over, and then it goes away. So it's not something that lasts in your body or is included in your body for a long time. Once you have the spike protein, your body then forms an immune response, and that will protect us if we're exposed to COVID-19. This is a slide showing the adenovirus vector vaccine. That's the Johnson & Johnson or Ganson vaccine. Very similarly, it just has this virus that is not a human virus, so it can't affect you because it can't replicate in the body. So this is something that it can replicate in other animals, but not in the human body. Again, similarly, it gives you instructions. You make the spike protein, and then all these cells that are your immune cells then learn how to fight it and are able to make a response. Again, this is a 1-dose vaccine. So just some specific questions that I've gotten in the past. One of the questions I often get is, can you get COVID-19 from the vaccine? Again, after the mRNA teaches your cell to make the protein piece, the cell breaks it down and it gets rid of it. It does not enter the cell's nucleus. It doesn't affect or interact with our DNA or genes in any way. And because you were not using the virus, like there's no virus, we're just giving the instruction manual, they can't give you COVID-19. And I think it's really important that, there's a lot of different vaccines being developed, but none of the ones being developed in the United States actually contain the virus that causes COVID-19. A lot of people will have side effects, and I think Kim mentioned some of the side effects she had. This is just a sign that your immune system is strong and it's working and it's learning from the vaccine. So a lot of people will get some side effects. The most common thing is sore arm. Many people complain of the sore arm. More uncommonly, people will get fever, muscle aches, headaches. These usually come in about 24 hours after you get the vaccine, and most of them resolve after a day. If you do have these symptoms, please take some Tylenol or Motrin just to make yourself feel better and take the day off and rest if you can. But these are not symptoms that last longer than a day. Most people feel back to normal within 24 to 48 hours. I also think that in my mind, I actually didn't have any side effects, and it made me feel a little anxious because I wanted to have that good immune response. So if anything, if you do have these side effects, your immune response has been really strong and robust. And also, again, please don't forget to come in for your second dose. That's the best way to make sure you're fully protected against this, the devastating effects of this virus. Again, same thing, reasons for feeling unwell. It's very common because you're building immunity. So as I've shown over and over that, this is a very effective vaccine. It's also a very safe vaccine. That's now been tested in 100,000 volunteers, and this is in a study setting. We now know that even just in California, we've had millions and millions of people get the vaccine. In the United States, even more, and then now internationally. So we are really tracking very carefully to make sure these vaccines are safe. The trials that were done, half the people got vaccine and half of them got just salt water. And the vaccines were tested in a mix of people that was very diverse, including older adults and people of color. They were found to work very well and be equally safe for all. So like I mentioned, the safety was studied, not only in the study by the people who were doing the trials, but also by the Food and Drug Administration and the Center for Disease Control. And now we're continuing to monitor. So as millions of people are getting this vaccine, we're continuing to ask everyone to monitor for the safety of the vaccine. So there's two different methods. The first one is Be Safe. So for anyone who gets a vaccine, you should get instructions on how to log on to the CDC website and sign up for this program. You put in your phone number, and every day it checks in with you and asks you if you have any symptoms and how you're doing. If you do have any adverse events, you can either report it to Be Safe, or you can you can report it directly to the CDC through a program called Vaccine Adverse Events Reporting Registry, or VAERS. And it's all on this same website. Same on the same website. So you can go on the website, and if you report it, it will be compiled, and they'll call you and get more information. And again, all this information is being shared by everyone. So if there's any sort of signal that suggests that people are having side effects that are unusual, then they'll immediately let us know, and we'll be able to disseminate that information to everyone who's received the vaccine. Luckily, so far, we have not seen this. The only side effect that I think we've seen is that about 1 to 2 out of a million will have a severe allergic reaction. And that's really been the only safety signal that we've noticed, but we're still monitoring. So another question I often get is, if you've gotten COVID-19, should you get the vaccine? And I think in general, we think that most people who've had COVID-19 have a degree of safety for several weeks to months after they've gotten the disease. However, we do know that the vaccine will even protect you even more. So if you have had COVID-19, we know that you can get reinfected, and we know that the vaccine is safe and probably very effective. So we do recommend that everyone who's had COVID-19 consider getting the vaccine as well. We do ask that you wait until your isolation period is over. So, you do have to wait 10 to 20 days after you've been diagnosed until you're no longer infectious. And that's mostly to protect the healthcare workers who are going to be giving you the vaccine. If you've received monoclonal antibody treatment for COVID-19, in that case, we ask you to wait 3 months. And that's mostly just because if you have the antibodies in your body, you won't have a strong response to the vaccine. So it's better to wait until the antibodies have gone away, and then you will have a strong response to the vaccine. How about those who have weakened immune system? So the studies that were done did not include people with weakened immune systems. However, we do know that people who have weak immune systems are at higher risk of getting COVID-19 and more likely to get very ill. So we are advising everyone to talk to their doctor. We do believe that this vaccine is very safe and will provide some degree of protection. So many people who have weakened immune systems have decided to get the vaccine because, again, it'll be safe, and we do think that it will be effective as well. The studies, the Mrna study specifically did include people who had stable HIV. And again, this vaccine was safe and effective for them as well. So that was good evidence, and there's still trials ongoing. I mentioned that some people have had severe allergic reaction. Like I mentioned, it's about 2 in a million, so it's not a very common thing, but it is definitely something that we're monitoring for. So if you get the vaccine, a lot of times we'll ask you to sit in your car or stay around in a chair so we can monitor you for 15 to 30 minutes. And that's just because we're making sure you don't have the allergic reaction. People who've had a history of an allergic reaction to a vaccine, anaphylaxis, meaning that they needed to go to the hospital. If they've had a history of allergic reaction to vaccine or injectable therapy or polyethylene glycol or polysorbate, should talk to their doctor. In that case, maybe we want to do some additional testing before we give you the vaccine. But if you're just allergic to other things, many of us have allergies to peanuts or bee stings or pollen. In that situation, you can get vaccinated. We'll just monitor you and make sure you don't have any sort of severe allergic reaction. Another question we get asked is if the vaccine will cause you to test positive on a coronavirus PCR or antigen test. So the PCR and antigen tests, those are the swabs that they put in your nose or really deep in your nose. This will not be falsely positive, meaning that the vaccine won't give you a positive result. The only reason you'll get a positive result is if you're infected. So there's no reason to think that the vaccine will cause you to test positive on the swabs. If you get a blood test, some of the blood tests do look for antibodies against the spike protein, and you can have a positive result for that. So the blood test, yes. For the nasopharyngeal or the spit or the different kinds of swabs on your face, those should only be positive if you're infected and not because of the vaccine. Another question, I get two versions of this question. One is, can you get it when you're pregnant or breastfeeding? The studies initially did not include women who were pregnant or breastfeeding, but we do know that pregnant women are more likely to get sick if they get COVID-19. And if you work in a job that puts you at high risk of getting COVID-19, it might make sense to go ahead and get the vaccine. They've done animal studies. There's no ill effects in animal studies. They've done a lot of different small groups of studies, and there's no ill effects on the pregnancy. So I think a lot of individuals who are pregnant, after talking with their physician, they choose to get the vaccine, and they're collecting this data. And so far, there's been no adverse events noticed on the pregnancy or on the infants. So this is something where you just talk to your physician and make a decision together. The other question I get is about fertility. Does the vaccine affect fertility? And there's no evidence that it affects fertility. So I just wanted to put it out there that I've heard that there's a rumor about that. And no, the vaccine does not affect your fertility at all. There's a lot of myths, so it's really important to get your facts from a source that you can trust. And so we have some website, the LA County Department of Public Health website, where we go through all the different myths and the frequently asked questions. The CDC also has a lot of information. So I think it's really important for you to use trusted sources to get information and facts about the virus. And of course, or the virus and the vaccine. And if you have any questions, of course, we're always available to answer those as well. So now that I've told you about the vaccine, I'm sure many of you are hoping to get it soon. So the best place to look for information is this website, vaccinatelacounty.com. It gives you information about who is eligible, where you can get it, and then you can actually make your appointment. It also tells you what kind of documents you should bring with you. As of last week, we had administered almost 2 million. I think now we're over 2 million vaccines administered, with about 1/4 of those being second doses. So we are able to getting more and more individuals vaccinated. There's 10 million people in LA County. I would say about 1.5 million of them are not eligible to get the vaccine because they're less than 16 years of age. So we're making good headway. As far as how we're vaccinating individuals in the early childcare and education sector, right now, the best way probably, or the easiest way to get the vaccine is to go either to your healthcare provider if they're offering vaccine, or to go to the county-run megapods. So there are 5 different sites. As many of you know, there was one at the Forum, one in Magic Mountain, one in the Pomona Fairgrounds, one at Downey, where the LACO building is, and I'm of course forgetting the 5th one. But there's CSUN in Northridge. So you can go there. There's specific days reserved for childcare workers only. Those are on Saturdays. So today is one of those days. It's our first day for the childcare sector. So we're really excited to get individuals vaccinated. There's also an opportunity at Children's Hospital Los Angeles. They're also vaccinating early childcare staff. They have a clinic, I think, tomorrow, and then they'll have more clinics next week. And then any place that is giving vaccines should be able to offer you vaccine as well. So if there's a CVS or Walgreens, any pharmacy, anywhere who's a vaccine provider should be able also to give you vaccine. So I would check with all those places as well. To register for the county megapods, the best way to get an appointment is to go to this website, myturn.ca.gov. And then you check your eligibility, and then you can sign up if there's appointments. The appointments become available on Sunday afternoon, and they tend to go quite fast. So if you have an opportunity to be next to your computer on Sunday afternoon, usually they'll go live around 11:30, 11-ish. It changes every week, but that's the best time to go and make your appointment. I also want to say that our goal is to give you some specific codes, so that way you have a guarantee of an appointment. Using a code is a little bit more complicated, but some of you might receive codes to help you make your appointment. And that is through the same website. They ask you to choose your age, you put childcare and education, you live in Los Angeles County, and then it asks for an accessibility code, and this is where you would put your code. And that will give you access to your appointment. Again, these codes are a little bit confusing because when you get a code, it's linked to a dose. So if you have a code, that means that that code is linked to a dose at one of our mega sites. So if you live near a Pomona, that area, you want to make sure you get a code that's linked to the Pomona Fairgrounds, and I'll take you and I'll help you make your appointment. And this is a way of making sure that everyone who needs to get the vaccine is able to access a vaccine. Because like I mentioned, these vaccines are in really high demand and we have very limited supply. So we want to make sure that every single person who's been working through this pandemic in childcare and education, like all of you have this access and are able to make an appointment. As far as what should you bring with you, so a photo ID, it doesn't have to be government issued. It could be your Costco card. It could be anything that has your picture and your name on it, so we know it's you. You need some sort of proof that you live or work in Los Angeles County. We have very limited doses of vaccine, and we want to make sure we're vaccinating people in Los Angeles County with our very limited doses. And then we need some sort of proof that you work in the education sector. And so we do have a list of whatever, what kind of licenses and what we accept. So some of the examples of that is if you have a copy of the state of California license for the center, or you have an attendance sheet, those would be things that you could use to come in. For some childcare facilities, we also will accept letters. So all those details will be on vaccinatelacounty.com. And I believe that's it. Thank you.
Wonderful. So I'd like to encourage any of you that have questions to please go ahead and put them in the chat. I haven't seen any come in. So Veronica, yes, please go ahead and put them in the chat. I'll start with questions that we had to begin with. And let's see. So our first question is, how do we get the codes?
I'll go ahead and speak to that. Hi, everybody. This is Deborah Coleman. I'm the director of the LA County Office for the Advancement of Early Care and Education. I'm so happy to also be with you here today. My office happens to live within the Department of Public Health, so it's kind of like a 2-for-1. We're the only county that has an early care and education office that helps the LA County EC system and also is a part of public health. So we have a lot of attention on early care and education right now. So the ECE response team for LA County has been meeting for the past year, and hopefully you all have been accessing resources, materials, and support from your local resource and referral agency to be able to get you through the past 12 months. We are working to develop a system to get these codes out really effectively. It looks like we will get codes weekly on Wednesday, and they will tend to be distributed on Thursday morning. They are going to be distributed through a few different sources. They will go out through your local resource and referral agency. SEIU will get a series of codes. And if you are or know anyone who is connected to a Head Start, those will go through the County Office of Education. I really encourage you to contact either SEIU or your local resource and referral agency and make sure that you get on a list to get a code. One thing I will say is the codes are connected to a dose on a specific day at a specific place. So please be sure to, if you use it, it is only for you. It is attached to one person and that's you. So be sure to use it for that day and to show up for your appointment.
Wonderful. So the next one is, will it be mandated for childcare providers and assistants to get the vaccine?
I'll go ahead and take that one again. This is an emergency use authorization for all 3 of the vaccines that we are using right now. And since it is an emergency use authorization, it is not mandated. Once we go through, a few years and have more research, then we don't know what will happen then, but currently it's not mandated.
The next one is, do my employees get the vaccine also? And if so, how? I'm sorry, Deborah.
Deborah, I think you're muted.
I didn't click quick enough. Darn, that's Saturday. Not enough coffee, guys. All right. All early care and education staff are eligible for the vaccine at this time. The first thing I want to say is, although we have codes specifically for you, as Dr. Yagana said, you don't need a code to get a dose. You are eligible and go to anywhere possible where you can get an appointment and get your dose there. All staff working in early care and education are eligible, including any assistants or maintenance folks. Since this is all family childcare, yes, any of the assistants or staff that you have working with you are eligible. Documentation for family childcare, I would encourage a few different things. Anyone can bring in, any of your staff can bring in your family childcare state license. You can bring in, if you receive vouchers through the alternative payment program or any subsidized program connected to CalWORKs, you can also bring in an attendance sheet. Be sure to redact the child's name, but you can bring in the attendance sheet as proof of documentation. You also, if need be, can get a letter from either your local resource and referral agency or alternative payment agency, basically certifying that you are employed in the childcare field. They do have a template for that, and I would recommend you to reach out to that.
Wonderful. The next one is, it sounds, and this one comes in Spanish, so I'm going to do my best to translate it. It sounds as if it's an experiment. How true is this?
So this was, it's a very good question. I know that this happened a little, quickly. And so people are asking, how good are the studies? And I do want to say that we've had, unfortunately, not in this country, but in other countries, we've had pandemics with coronaviruses. So many of you know in Asia, about 15 years ago, they had horrible SARS pandemic that killed thousands of people. So starting 5 years ago, we were looking for a good virus for this type of a good vaccine for this type of virus. And so they started looking at different types of vaccines that would be very effective. And so as soon as we heard about, this new, very similar virus coming out of China, the vaccine study started. They have done every single phase of the trial. So just like any other vaccine, it's gone through phase 1 studies, phase 2 studies, phase 3 studies. There's been, so many scientists all over the world working on this and trying to perfect this, because this has been so devastating for all of us. And so really, this was an opportunity for every top scientist to come together and try to come up with a system to really end the pandemic, or prevent people from dying. So it really has been studied well over and over to be safe and effective. So I would again say that this is very true. I think most of us on this panel have been vaccinated. I was vaccinated, my parents are vaccinated, because we really do believe that the science is very accurate and very well studied, and we think that this is the way that we're going to keep us safe. So I would encourage you to also do the same, for not just for yourself, but for your family and for your community, to keep everyone safe as much as possible from COVID-19.
Thank you, doctor. The next one is, if I had COVID in the middle of December and I have the appointment tomorrow for the vaccine, I'm assuming, is it safe to get it? It's barely going to be 3 months.
Yeah, I think it's definitely safe. Please get it. As soon as you're no longer infectious, you could get the vaccine. So usually 10 to 20 days afterwards. So you should definitely get it and protect yourself.
Okay, and this one comes in Spanish. Would you please be able to repeat once again about the people who already had COVID, if you recommend that they have the vaccine?
So yes, I as a physician would recommend that you get the vaccine after even if you've had COVID-19, because we know that COVID-19, once you've had the disease, you still can get reinfected. Many people have gotten reinfected. And so we believe that the vaccine will protect you from getting reinfected and keep you safe.
And the next one, how can I go about choosing which vaccine I want, like Johnson & Johnson? Do I have to go to a specific place?
So at this point, because we have so few vaccines, we recommend that you get the vaccine that is offered to you. That being said, we do try to put what type of vaccine is offered at every site, so you can look. But again, I think the most important thing you can do right now is to get vaccinated, and all of them will prevent you from dying. So, and getting severely ill. So I think the most important thing, the first message is, please get vaccinated with whichever vaccine is offered to you. However, we do try to put the type of vaccine that's being administered on the website on vaccinatelacounty.com, so you know what kind of vaccine you're getting.
Wonderful. The next one is, will the vaccine help fight the new variants?
That's an excellent question. There's studies ongoing. I wish that I could give you more information on that, but all the studies that have been done so far suggest that the vaccines are effective. You have less of an immune response with some of the variants, specifically the South African variant and the one from Manaus, Brazil, or the ones that were first identified, but you still have an immune response, meaning that they are protecting you, but maybe you don't have as much of an immune response. So definitely offers you protection, but more to be, the percentage we don't know yet because we're still learning. But I feel confident that these vaccines will offer you protection against the variants.
Wonderful. Thank you, doctor. I think this one's for Deborah. Can my family also get the vaccine, although the vaccine is currently not available to them?
So that would depend if your family is living in a family child care home. So if you have family members that are living in your place of work, which for many of you is a family child care home, they would need to prove that they live in that home. Because the way the system is set up, we were very intentional and conscious of knowing that your family members are trust lined. They've gone through background checks. They are a large part of making sure that there is no outbreak in your family child care. So yes, if they live in the home where the family child care is based, they can get a vaccine.
Thank you, Deborah. Dr. Regana, this one's for you. And it's in Spanish, so I'm going to translate as I go. I got the Pfizer vaccine on 2/30/21. So I'm thinking it's 2/28/31. And it caused me The side effects that it caused me were diarrhea and a lot of nausea. I have not been able to eat well. I also got gastritis. How long should I wait for the second dose? Because as it's been said, the second dose is worse. How long should I wait so that I can recuperate and be strong enough? Because I feel very weak.
So that's a really interesting question. Thank you for asking it. I wonder if maybe this has nothing to do with the vaccine itself. I would recommend seeing a physician. Some people do get a little bit of nausea. It's a less common side effect of the vaccine, but having diarrhea that lasts for several days doesn't sound like a vaccine side effect. To me, it sounds like maybe you have caught a different virus that might be causing this. So definitely, I don't think this is a vaccine side effect that's been reported as far as I know. So I would see your doctor about seeing what was causing all the vomiting and diarrhea. So you shouldn't have it with a second vaccine because it doesn't sound like a vaccine side effect. Again, a little bit of nausea, maybe some people, body aches, headaches, some low-grade fevers, but vomiting and diarrhea lasting several days is not a side effect of the vaccine. That's just, I think that's a different illness. That's a separate issue.
And can you just retouch on how long the side effects from the vaccine can last?
Yeah, so the side effects from the vaccine were really within 24 to 48 hours. So it shouldn't last for days. It should last for a day or two. So if you're having symptoms that last longer than, if you get the vaccine, say today, and you're still having symptoms Monday night, really at that point, you should call your physician.
And I'll just speak to my experience a little bit because since Dr. Ugana didn't have any side effects, I am also fully vaccinated. I feel like the more people you meet that are vaccinated and you can see are normal and functioning and walking around and, happy, healthy people, the more you realize that this is a safe vaccine. I will say for me, I did have an immune response with both the first dose and the second dose. I felt like I had the flu for about a day and a half, chills, muscle aches, but within the weekend that passed, I was fine and 100%. So for those of us who do have immune responses, I have talked to folks that had very similar experiences.
Okay, so Deborah, maybe based on your experience, and Dr. Ugana, based on your studies, what are the most common side effects?
Yeah, so the most common one, and that happens in about 80% of people, is pain. People feel like someone's punched them in the arm for a while. And that, that can last, again, a day or two. So if you have a big tennis tournament or something that you're using your arm, maybe just consider that. Otherwise, with the first dose, about 5 to 20% of people will have the symptoms that Deborah described. With the second dose, more people will have that, but it's mostly headaches, muscle aches, and people can have some low-grade fevers, again, lasting 24 to 48 hours. And you can take Tylenol or Motrin if you're having those symptoms, then usually people feel much better after they've taken that medication. But you should take that only if you have the symptoms. Please don't take the Tylenol and Motrin going into the vaccine, assuming you'll have those symptoms, because many people won't have those symptoms. And there's some concern that taking it before getting the vaccine can affect your immune response. So.
Wonderful, thank you. The next question is it true the vaccine has COVID-19?
That is not true. The vaccine does not have COVID-19, SARS-CoV-2, which is the virus. There's no SARS-CoV-2 in any of the vaccines available.
Wonderful. Do you think there will be a booster needed?
I don't know. That's a very good question. I think many people are considering that option, especially if we find that the vaccine for some reason isn't as effective as we want it to be against variants. There is, people looking at that. And we won't know until a few more months down the road, but we're hopeful that the vaccine will protect us against the variants. If it doesn't, people are working on a booster series to give, so you can have that additional protection.
Wonderful. And the next one's a two-part question that I believe is for both of you. To get the family the vaccine, how would we have to make the appointment? And also, I have 3 daughters, one 15, 10, and 2 years old. Would they be able to get the vaccine?
So I'll take the second part and then Deborah can take the first part. So no, your children cannot get the vaccine. It's only approved for individuals 16 years of age and older. We don't have any pediatric vaccines available currently.
Yes, thank you. That's a very good question. So everyone needs an appointment to get a vaccine. Please do not show up at a vaccine site thinking that there will be appointments that are just available. Everyone does need an appointment. So if you have, again, a family member living in the family childcare who has been trust lined, because they are essentially a part of your workplace and your facility, they would need an appointment just like you in the early care and education field and ask them to bring in a site license.
Wonderful, thank you. The next one is there an age limit? I received my vaccine as well as my husband. However, one of my assistants does not want it. So I am worried that my 15-year-old daughter will be exposed. Is my daughter able to get the vaccine?
So no, your daughter will not be able to get the vaccine. Only people who are 16 years of age and older are able to get the vaccine.
Thank you. And the next question, taking into consideration that as childcare providers, they're independent contractors and most of them don't have health insurance, how much would we pay for the vaccine?
The vaccine is absolutely free. So you should never have to pay for the COVID-19 vaccine.
And the next question is in Spanish, so I will translate. What is the maximum amount of time that someone should wait for the second dose?
There's currently no maximum amount of time, but we do recommend that you try to stay within the time frame that was given. So for Pfizer, that's 21 days after the first dose. For Moderna, that's 28 days. So the faster, the quicker you get both doses, the quicker you are to be fully protected. So as much as possible, try to stay within that. If you are late, you still can get the vaccine, and we encourage you to get that vaccine. But so there's no maximum time, but again, the quicker you get the both doses, the quicker you are fully protected.
Okay, and this next one is also for the, what if they don't have access to a computer to sign up for the appointment?
I'll go ahead and take that one. So vaccinatela.com also has a call-in line. If you don't have access to a computer, I want to say you can access on your smartphone that website, and you can make appointments on your smartphone as well. So you don't necessarily need a computer if you have a phone that has internet. Now there is an 800 number at vaccinatela.com. I'll make sure, and Dr. Yagane just put it in the chat. So now you have it. Because we really want to reserve that to those who really do not have computer access. If there's any way that you can make it online, because we are trying to vaccinate all of LA County, please make your appointment online. But if you need support, then definitely you can use that call-in number.
Okay, and follow up to that one is, what if they don't have a car? Will they be able to walk through a site to get the vaccine?
Yes, so there's a lot of walkthrough sites. You can look at vaccinatelacounty.com, and even our drive-through sites, our megapods, there is a walk-in option for people who live in that community.
Okay, and do they have to wear their mask after they've been vaccinated?
At this point, yes, you do have to wear your mask. Because again, not everyone is vaccinated yet.
Okay. How would you know how long the vaccine will protect you when cases go up?
These are really excellent questions, and I wish that we had all the information. We at this point feel confident that the vaccine will protect you for 3 months. And we are looking at the data every single month to see how much protection it is offering. So the vaccines have only been around for a few months now. So it's hard for us to tell you how much protection will provide in 2 years. But I would think that most of us feel very confident that it will protect you for longer than 3 months. We're just waiting to gather the data, but we do think that it will offer you protection for several months down the road.
Wonderful. I think this one's for Deborah. Will the COVID-19 vaccine be mandatory for family child care providers?
I think we touched on that, but I will say it one more time for anybody who came on a little bit late. So right now, all vaccines have emergency use authorization from the FDA. So it is not mandated at this time.
Deborah, also, how soon will family child care providers have access to the vaccine?
Right now. So we opened up on Monday, on March 1st, to the early care and education sector. We are so happy to be able to provide it to everyone who has been on the front lines. I just have to do a shout out for family child care, because as somebody who tracks who's open and who's not, every month throughout this pandemic, family child care have been the stronghold. So I really give thanks to you. We honor you, we commend you, and we're trying to figure out more ways to support you. If you are a family child care provider, you are right now eligible for the vaccine. So you can make an appointment at vaccinatela.com, anywhere that you can get an appointment. Again, I want to stress supplies are low. So if you are eligible, there may not be appointments right away. But having been on that website to check if appointments are open, it literally changes minute by minute, depending on when we open up more appointments. We are going to try to get codes out to you every week through your resource and referral agencies and through SDIU for appointments only for early care and education, but that should not stop you from trying to get an appointment now and getting it anywhere you can.
Thank you, Deborah. Dr. Ugana, I believe this one's for you. What happens to the vaccines from no-show appointments?
So we usually don't draw up vaccines until we know people are showing up. So we try to make sure that every single vaccine goes into an arm, and we're very, very careful not to open a vial of vaccines until we know people are sitting there. But if we should have, if 3 people are sitting there and our vial has 6 vaccines, then we have 3 extra doses. We usually try to find people to give those doses to who are in the sectors. But luckily we do have a waiting list in most places, so we can call people who are interested. But I think, again, it's very rare that we have a single dose that we need to give.
Wonderful. Also, can kids spread the virus?
Yes, so children are carriers of coronavirus, and they can spread the disease, and that's why children are encouraged to mask as well. Most of the data suggests that they're less likely to be infectious, meaning they're less likely to spread than adults do. So most of the outbreaks that we've seen in almost every scenario, including in the education sector, has been adult to adult transmission. So it's very, very important that you make sure to protect yourself, not only, by wearing a mask, but making sure every single adult you interact with is wearing a mask. So yes, children can spread, but it's most of the outbreaks and most of the transmissions happen from adult to adult and less likely from child to adult.
And I do just want to emphasize, because I do get this question every week, if a child is 24 months or older, they are asked to wear a mask. That is part of keeping everyone safe in your family child care home. It is part of the guidelines, both from the state of California and from the LA County Department of Public Health. So we do ask that. We have had over 70 outbreaks in the early care and education sector. Luckily, because everyone's been doing such a great job with masking, they have gone down considerably over the last month as our community transmission rate has gone down. But I do want to emphasize, even right now, once you get vaccinated, please, you, everyone, and the children 24 months or older should be wearing a mask. And one of the most common things we see is staff taking a break together and taking off their masks and eating. And especially if you're in an enclosed space, that's a really great way to transmit virus. So although we are missing social interaction, you know, having lunch outside is a great idea. And not being in the same room with someone who is unmasked and eating until we really get this virus under control.
Deborah, I have a follow-up question for you on the 24 months plus. As a provider myself, and especially with really young children, children that young wearing a mask tend to, you know, touch their face a lot. You know, what do we do in those instances?
That's a great question. I think what we are just learning to do as early care and education professionals is do the best we can. Nothing is going to be perfect, but the research tells us that wearing a mask really reduces transmission. A lot of times we encourage a child having multiple masks. We know also kids are active and they do put their hands on things and get dirty. So having masks that you can change during the day is a great way to do it. It's not going to be perfect, but it is a really great protector. So just keep on doing the best you can and whatever you can do to make sure your facility is safe.
Wonderful, thank you. How are the studies looking for kids getting vaccinated? I believe that they meant, how are studies looking for a vaccine coming out for children?
Yeah, so studies are ongoing for vaccines in children right now. I think they've just finished recruitment on the Pfizer study. They're still recruiting for the Mrna study. This is again for mostly adolescent kids, so it's like 12 to 16. I think it's going to be a while before we have vaccine for very young children. So I think that for now, the most important thing we can do is protect ourselves and get vaccinated, and hopefully we'll have information on pediatric vaccines soon. And I just want to go back to Deborah's comment. So my child goes to preschool as well. And I think it's really important to think about that, the Swiss cheese model. I don't know if you guys have seen it, where no intervention is perfect, but if you like put them all next to each other, then the virus, it's hard for it to go through all the different holes to get to you. So, you know, if masking is not 100% because you're working with a bunch of 2-year-olds who are very difficult to mask, being outdoors, you know, and having good ventilation. And if, if that's not working, making sure you're doing a more social distancing if you can. So really trying to use all the tools we have in our toolkit, and none of them are 100% perfect, but together they really do protect us. So vaccine is one of those tools. So social distancing, masking, vaccine, and then good ventilation and hand washing. Everyone talks about hand washing as well. So.
Okay, so here's a follow-up question to that. Is there a recommended indoor temperature for indoor classrooms, daycare areas that will help keep germs at bay?
I mean, no. Some germs like cold weather, some germs like hot weather, some germs like temperate weather. So every germ has its own, you know, there's a lot of outbreaks with listeria. They love refrigerated weather. There's a lot of, in general, coronavirus likes to be at colder temperatures. So as it gets a little bit warmer, we tend to see less coronavirus. But the most important thing, I think, is sunlight and ventilation. So being outdoors and being in sunlight really does seem to affect the viability of the virus. So we are very lucky that we're in Southern California. You know, pile on the sunscreen and try to get outside as much as possible. Open windows, etc.
Thank you. The next one is, if a child gets a fever and the mom refuses to accept that the child has a fever, what can we do?
Deborah, I'm not sure. How does a mom refuse to accept that a child has a fever? I think that's
a hard one.
That's an objective measure. Can you? I think you need to have better communication and better trust. If you're not able to have that with the family, then maybe it's not a mutually therapeutic relationship for you guys.
I'm going to agree with that.
Okay.
You just keep communicating the best you can. As Dr. Yagane said, a fever is measurable. It's usually on a thermometer. So
To show proof.
It is difficult. I will say that our preschool has stopped doing the temperature checks in the morning because some people are sitting in a car and these thermometers are not fantastic, and you'll wait 15 minutes and check it again and it'll be normal. So I do want to maybe take that perspective that, you know, if you maybe take the temperature more than once to have several recordings, but thermometers are not perfect, especially the ones that you're doing from a distance. So, you know, using measuring two different thermometers or something, but if it's a fever, it's a fever. So
Thank you for that. The next one is this going to be a yearly vaccine, or once you take the second dose, you should be covered permanently?
Fortunately, I don't know that answer yet. I think many of us think that you might need a booster or a third dose at some point, but we just don't have that information, and we'll have to update you as we find out more.
And that covers us for questions. If there's anyone that has another question, please feel free to ask away. Anyone? Don't be shy. Your questions are very, very good questions. Don't worry. Don't think, oh, maybe they already went through this. Don't worry about it. It's okay to hear it again.
And while we're waiting, I'll just add that we do have some systems set up to support you. So I want to share a little bit about those. We do have a toolkit for early care and education that has all documents that you should need to operate safely at, I'm going to read them so I don't mess them up, at publichealth.lacounty.gov. You can find the Early Care and Education Toolkit. It was the first toolkit we got up because you guys are so important. If you have any questions later, feel free to email the LA County ECE COVID-19 response team, which is a collaboration led by LA County Public Health, the County Office of Education, and First 5 LA. You can email us there and we will get back to your question. And that's eceresponse@lacoe.gov. And finally, if you would like best practices or tools, the LA County ECE response team has stood up a website specifically for all of you, and that is childcareheroes.org. So feel free to go there and download some tools. We really are trying to do the best we can to support everybody through this challenging time. And yes, I will put the websites in the chat. I see that question.
Thank you so much for that, Deborah. ¿Alguien más que tenga alguna pregunta? Por favor, no se sientan intimidados. Todas las preguntas son preguntas buenas. No importa si ya escuchamos la respuesta y necesitan clarificación, por favor, hagan su pregunta. Okay, I think that's going to cover us for questions now. So I'd really, really like to thank you, Dr. Ivana and Deborah, for being here with us and sharing all this wonderful information with all of us today. Giovanna, I'd like to pass it on to you once again, honey.
Awesome. Well, thank you everyone for your time. And please know that this recording will be posted in our website in the following days in case you want to hear it again. And if Ms. Kim is around, if she would like to share how you can stay informed and connected via our websites, SEIUlocal99.com/childcare for all. And Ms. Kim can share about our Facebooks and why she's a member of our union. Thank you.
Okay. Thank you, everybody, for being here today. We invite you to stay updated by joining our Facebook at 99CCP or at CCPU California, and by visiting our website. Most importantly, if you're not a union member, we need you to join thousands of providers across the state working together to build a better future by signing up as a member. Please share in the chat if you're interested in joining. I can tell you, Giovanna and I were speaking earlier before the meeting started, that even though I've been a provider for 25 years, being a part of the union has really made such a difference for me. We all know that being providers is an isolating job. It's a job that we all do because we love children, but it is isolating, and being part of the union makes you feel like you have people, people who go through the same things, because people who don't do what we do for a living really don't, they don't really understand the things that we go through. I mean, it's just, and having the networking, meeting other providers, knowing that if you're a new provider, there's people who've been around for a long time who are willing to be mentors to you. The Facebook will give you can come to the Facebook page, ask questions, and there's always somebody who's there to give an answer. It's made such a difference. We worked really hard. It's been something that we worked for really for a long time, and it's made such a difference. For me, I was saying to Giovanna, I just feel it just makes me feel like I feel like people appreciate us more, that we are professionals. There's a cat outside my house, sorry. And but we don't always feel treated that way. So being part of the union really makes me feel like I'm part of, that what I do, I know what I do matters, but being part of the union helps reinforce that. And just the people that I've met through the union. So if you're not a member, please put in the chat if you're interested. Please come to our Facebook page. We're trying to do fun things, social hours, things like that, so that we can share information with each other and just help each other get through. Because, I know there's been a lot of platitudes. We're all in this together, but we are all in this together. We are not necessarily, we're in the same storm. We're not all in the same boat, but what is going on out? Oh, the gardener. I hear something on my roof. So anyway, please, if you're not a member, please consider joining. If you have friends that are providers, if you are a member, but you know other providers, please bring them to our Facebook page, and we're all here together. So let's just hang in there, because there's a light at the end of the tunnel, and get your shot. Get your shot, get your shot, get your shot. I love that I have my shot, or my 2 shots. So I don't know, I guess that's it. How do you join the union? There's a question. We have, you can sign up online, sorry.
We shared it on the chat. Thank you, Ms. Kim, for sharing. There was a couple of questions that came in towards the end. Are we no longer accepting any questions? Celeste, do you know?
Let's go ahead and take it, since we do have time, and I feel that it's very important. So one of the questions that came in was, do I have to get the vaccine the same vaccine for the second dose? For example, if my first vaccine came from Pfizer, should I get my second dose from Pfizer?
That's a really great question. In this country, we're really trying to follow the trials, and all the trials were done with the same dose for the second dose. So at this point, we are recommending that you get the same dose for your second dose as you would for your first dose. If you got Moderna, you should get Moderna. If you got Pfizer, you got Pfizer. That being said, if you happen to get the second dose with a different type of vaccine, we think that will work. But we would like to encourage you to do the same one. But if that mistake should happen, there's no reason to think it would not be effective. Some of you might know in other countries, they're saying you can get whatever you want for the second dose because we all think that it probably will be effective. But for now, as much as possible, try to stick with the same vaccine.
And I would say, just going from a practical aspect, for those who are wondering what it looks like when you go in and get your vaccine, you'll get a little card from the CDC that says what vaccine you got. You're also going to then be in the CalVac system. For everyone who's been vaccinated in California, you're going to get a text from them and be able to download that little card to your phone. It's in my iPhone wallet now. So I have it no matter where I go, because you always have your phone.
That's wonderful. Thank you for that information. Giovanna, did you see anything that I might have missed in the chat?
Well, Dr. Nava Yevane did answer this in the chat, but the clarification question was, so basically you are saying as of now, you only have for sure coverage for 3 months.
Yeah, and I answered, I think, again, we're being really, really careful. We're being very, very cautious. We're trying to make sure we have science and data to support everything we're saying. And right now we only have data up to 3 months because the vaccines were only made available in December. Based on what we're seeing with the immune response, we suspect that you're going to be protected for much longer. We think possibly years, but we don't know that yet. So for now, we know 3 months. Next month, we'll know for 4 months, and we'll continue that way until we are able to give you more information.
Wonderful. Thank you, Doctor.
To make sure that you're getting current information, this is not your only opportunity. The Department of Public Health does briefings every few weeks for the ECE community. If you don't attend those, I really encourage you to start attending those. Also, the ECE response team does webinars as well. And you can make sure you get on the email list for both by emailing eceresponse@lacoe.gov.
Thank you so
All right,
much.
I was writing that down.
I see Gloria has her hand up, and maybe May has a hand up. So May, go ahead.
May, we can't hear you, honey.
Hola, buenos días. Mi nombre es Gloria Delgadillo y mi pregunta es, oigo decir que después de que se pone la vacuna ya no tiene uno que usar la mascarilla. ¿Eso es cierto?
Hi, my name is Gloria, and I have heard that after we get the vaccine, we don't have to wear the mask anymore. Is that true?
Hi, Gloria. No, that is not true. We do ask everyone to continue wearing the mask and to do everything possible to prevent the spread of coronavirus. We still have a lot of coronavirus circulating, and at this point, we need everyone to continue wearing masks, to socially distance, to wash your hands, and do everything appropriately. The only difference is that if you have gotten both doses of the vaccine and it's been 14 days from your second dose, you don't have to quarantine if you're exposed to someone who has coronavirus. But please continue wearing the mask. Please continue to do everything possible to protect yourself and everyone else against coronavirus.
Thank you, Doctor. May, would you like
Muchas
to?
gracias.
She's offline.
Oh, okay. So that wraps us up for questions.
Thank you very much. Now everyone has a good weekend. Thank you so much. I will share this recording on our websites and our Facebook pages. Thank you very much to Dr. Yevana to give clarification, Deborah Coleman and Christopher Lopez, Dr. Tracy, just everyone, Jen and the team who put this together, Miss Kim. I hope everyone has a great weekend. And oh, of course, the translator, Miss Nubia, muchas gracias. Goodbye.
Muchas gracias por la información.